What is the worst, most awkward thing a healthcare professional has said to you while doing their job? I was injured playing sports. I found out later I snapped my ACL, partially tore both collateral ligaments, got a compression fracture of a couple of cm in my femur, took out a lot of my lateral meniscus, strained my popliteus tendon and got a sizable tear in my medial gastrocnemius. I went to A&E, the equivalent, being mainly supported by someone else. Sat down to fill out some forms. The nurse told me to go and hand the form to a desk on the other side of the room. I said that I couldn't walk. Can you hop? My dentist F told me my scruffy beard looked good but wondered in it was scratchy to the inside of my girlfriend's thighs. Burned my back at work one time. A doctor is applying a salve to help it heal and not get infected. Okay, so this is sulfadine. It's really good for burns. Sulfadine? Is that a sulfur-based medication? Yeah, why? I told the nurses I was allergic to sulfur meds. Doctor snatches up my chart, looks at it a minute, and says crap, then runs off, and returns a few minutes later with a nurse, and they proceed to scrape all the sulfadine off my badly burned back. Fun times. Usually people with an oral sulfur allergy do well with that cream. Don't want to risk getting a rash on a burn though, so I can see why they took it off. Not me, but my dad is terrified of needles. The phlebotomist walks up and in a very heavy Asian accent said, "This is the first time I do this." Turns out she had done that a million times, but had just recently started at this hospital in the US. It was the first time she had drawn blood for an American patient. I would have ran a mile hearing that. I had a really hot male neurologist. He explained that it is very dangerous for me to get pregnant while on this medication, so he said make sure you triple up, use a condom, take the pill and pull out. This is the only way to be 100% sure you aren't going to get pregnant unless you just don't want to frick. If you just aren't going to frick, that works too. I don't know why it felt awkward, but my mom was sitting right next to me. My doc was hot and my mom said, "Oh, she isn't fricking. She is a really good girl and wouldn't do that." My doc gave me the seriously triple up look. It was awkward and funny. A nurse misread my chart and thought it said my birthday was in 1993 instead of 1983. I was pregnant and married but rarely wore my ring because I was also a nurse and the fear of losing a ring and someone was real for me. She said, "Wow, I bet your parents are really mad at you." I said, "What? Why?" She said, "For being pregnant at 16. I was in a bad mood, so I said, "Hey lady, I'm 26 and married, but even if I wasn't, here's a tip. Don't lead with that. It makes you sound like a C." She complained to the doctor about me, but when I told him the story, he promised he would talk to her. I stressed that a scared pregnant teenager encountering her would be the worst possible situation for the patient. She probably hates me to this day, but seriously, what a C. Good for you for sticking up for scared young women who are pregnant. She should know better anyway. If you're C to a hormonal pregnant woman, you're gonna have a bad time. Whilst having a kidney specialist inspect me, on the 1st of April, he told me to drop my Wonder pants so he could inspect my dong. He squeezed it a little to look down my japs, and as he did he said "hello" down there and chuckled to himself. I was honestly confused, considering I thought he was just going to take an ultrasound scan of my kidneys. My dad was sitting next to me, and the doctor asked me if I was active in my private life, if I use drugs and alcohol and how often, etc. That was pretty awkward. He knew most things, except that I'd occasionally smoke herb, but still. Had a dentist start up with xenophobic comments about Polish people whilst he was mid-treatment drilling my molar. It's awkward enough when dentists start talking to you mid-procedure. How are you meant to respond? But that was pretty special. Notice how he squirms when you squeeze his scrotum. Right here. Got hit in the nuts. Hurt for a week. Turned out to be epididymal swelling. Doc was showing a hot 25-year-old female med student the different structures in my balls. I once went to the doctor because I had a sore throat. He felt my neck for lumps, found some, and told me it was very likely cancerous. He suggested I go to the emergency room that day. Then when I was visibly nervous, he told me that my behavior wasn't normal and I should also consider getting on medication. That's some flawed logic right there. Have you had any blood in your poo poo or pee pee? I was a 29-year-old male and this wasn't a pediatric doctor. If he can't use the right words, why would I take him seriously? This is the stuff that killed Michael Jackson immediately before administering anesthesia. It was topical at the time. I had a super Asian doctor do a skin cancer removal surgery thing on me. He basically used a small cookie cutter to pop a round disc of skin out of my head. When I was stitched up and it was sitting on the table, the doctor pointed at it, cracked a huge smile, and said in the most Asian accent ever, "It a rock like a worsen." It took a few times of asking what he was saying for me to realize he was saying the small chunk of my scalp in the table looked like Wilson from Castaway. When I was around 12, my doctor was examining my stomach, and I'm very ticklish, so I was giggling and he said, "Well, if you don't change you'll never get a husband." I had no idea what he meant by that. Fast forward to me being 16 and going to a new dentist. I have a strong gag reflex, and I do not do well with things in my mouth. So this butthole tells me I'm never gonna find a husband. So I bit his finger. Good. "Oh stop, it can't hurt. You severed most of the nerve endings," said to me by a surgeon inspecting a finger half torn off by a jagged piece of wood after my bleeding all over the reception area for 2 hours. I took a long hard look at the hand he had on his knee and the medical tray the nurse had next to him with a scalpel on it. The legal ramifications of quickly teaching a surgeon the psychological pain experienced when most of the nerve endings are severed and the tool he needs to do his job burned through my brain. Plus he was flat wrong. The needle for local anesthetic hurt like heck and things felt quite a bit better once things went numb. Lucky the assistant finished the stitching, or some of you might have one-handed surgeon stories to tell. I had a doctor call me through into his office after verifying I was okay with a medical student sitting in. He asks my problem and I told him I was supremely confident I had the clap. He asks to see my doodle, so I present it. He peels back my foreskin, rubs his finger around the head of my bench and then holds it right up to his nose and takes a deep sniff. He offered the student a belt of it, but she declined. We agreed on the diagnosis and I left with my script and this rather disturbing story. I told the doctor I used drugs occasionally for recreational purposes, and he asked me to hook him up with pingers, ecstasy. You can feel that? Well, no turning back now. That was during a root canal I had in Iraq when the dentist didn't numb me enough. It ended up getting infected and my face ballooned up after not receiving antibiotics. I was medevaced to a bigger base and they drained my throat for a week. I was held up in a hospital with actual war wounded soldiers and I was the talk of all the doctors as the botched root canal guy. Oh god, I'm so sorry. I had a pretty numb root canal and it was horrible. I can't imagine feeling everything. I was in the hospital a few years ago. I was 18 and lived too far away for anyone to be there for me. Nobody seemed to know what was wrong with me. In the middle of the night a nurse woke me up and said, "Megan, are you aware that you're pregnant?" I flipped out until I realized she called me the wrong name. Turns out Megan was in the room next to me. To make matters worse, my charts got mixed up for a second time. They told me I had to have an emergency surgery. They explained the whole procedure, asked if I had questions, and said they would operate within the hour on my lung. The doctor left and came back, apologizing, saying that the procedure was no longer needed. Nice dong, said my dentist once during a routine cleaning. It caught me off guard and was a bit strange, but then again I did have my dong out at the time. Well, that was a roller coaster of a comment. After finding out the baby I was carrying unfortunately stopped growing, I had to keep going back to the hospital for scans before they'd action anything, as my body wasn't miscarrying naturally, but they couldn't intervene until they had monitored over a couple of weeks. Every time I went in for a scan or to have bloods, each nurse always asked the same question: "So when are you due?" Each time was more awkward than the last when I had to tell them I'm not, cause we've lost the baby. If they'd just read over my notes they'd see this, but this was asked at least 5 times by different nurses. I am going to school to be a nurse and stories like this scare the crap out of me. I can totally see myself having a careless moment and saying something like this: "I am so sorry for your loss." During a gynecological pelvic exam at my college's health center, after being asked if I was emotionally okay after being abstinent for an entire 2 months. Nurse. Poking around down there, are you at the beginning or end of your period? Me. Pained, nope. Nurse. More silence and prodding hum. After another minute, are you at the beginning or end of your period? Me. Neither. I think my period was like 2 weeks ago. I lift up my head to look towards my pelvis, and the nurse's instrument is covered in bright red blood, thus her question. Me. Oh, is that normal? Nurse. Sure. My doctor didn't believe that I broke my arm, so before the x-ray came back he told me to stop acting like a girl. I am a girl, and 13-year-old me was very offended. It wasn't anything she said, just the looks I got. At my first visit to the student health center at college, for a regular gynecological exam, wouldn't give me my shot unless I had an up-to-date exam. They had a new doctor and an established doctor asking 18-year-old me all the intro questions about what sort of activities I engage in. Do you engage in unprotected fellatio? Yes. Do you engage in unprotected fricking? Yes. Do you ride backdoors unprotected? Yes. And so on and so forth. I don't remember it all perfectly since that was years ago now. At this point they're both staring at me like I'm Typhoid Mary PFSTs. Maybe they were surprised at the thought of this fat chick getting around so much, and apparently unable to come up with anything else to say. I realize they haven't read my paperwork at all. I'm married, I said, and then they both go into nervous laughter. Hopefully that was a good lesson to the student doctor. You know, actually look over the initial patient info before talking to them. I was around 12-13 when my neurologist leaned into my ear and said, "You should be my son's girlfriend. You could be his princess." I think it was the first time I had ever sensed awkwardness. Living in Asia as a Western guy, there is a stigma here that Western men get around a bit with the attractive Asian women. Needless to say, I haven't been blessed with such opportunity. I do, however, experience some testicular pain and go to the doctor's surgery. "Doctor, my testicle hurts." "Okay, so you've had lots of physical partners?" "Nope." "But you've had lots of freaking?" "Nope." "What? Not even once?" No." "Oh, that's not good. Can't help feeling that I've been judged by a stranger for my embarrassing lack of action. But I'll cling on to the fact that he was worried my lack of freaking ruled out an STI and thus meant I may have a serious problem with my ball. This was furthered when he immediately said, "Okay sir, let's talk about dead testicles." Yay. When I was teenager seeing my pediatrician for a physical, I mentioned my depression and how I was going on antidepressants. "You don't seem depressed." I was at a loss for words. "You didn't seem to be such an incompetent doctor, but I guess we all have surprises if you look hard enough." Worst, walked to my hospital bed and said, "You have cancer. What do you do? Do you study?" I said yes. He replied, "Not anymore." "Do you have hobbies?" I muttered yes. He replied, "Not anymore." He proceeded to break down my whole life and tell me that everything I do and like that I don't anymore, while my mum fainted and fell on the ground, to which he nor any other of the 6 doctors did anything to help. He left the room to me and my mum be a crumbled sobbing wreck. Holy crap, that's evil. I was at the doctor for my yearly physical and to get my birth control prescription refilled. The doctor told me that I should switch to either abstinence or the rhythm method rather than continue to take birth control. This was a several-minute conversation, not just a quick comment. He then tried to explain men or women don't realize this is an option, which left me even more dumbfounded since that's been the only steady lesson in physical education in the US for decades. I was also well into my 20s at this point. Jesus. I hope none of his other patients listened to him and ended up with an unwanted pregnancy because of it. I scratched my cornea and went into the med station. The doctor wanted me to take a pregnancy test before he prescribed pain meds, and when he came back to tell me it was positive, I was more than a little shocked. I was 20 at the time. His response was, "Well, that's what you get when you mess around," and later in the exam he asked, "Do you even know who the father is?" When I returned 24 hours later for a checkup, he told me my eye was healing fine but asked, "Have you decided what to do about your other little problem?" My wife and I got new insurance and were thus meeting with a new doctor for the first time. During the appointment, we bring up that we're polyamorous. as we feel it's relevant for our medical care. The doctor gets a look of shock on her face and the first thing out of her mouth, in the most accusatory tone I've ever heard, is, "Do you have children?" I was never more glad not to have children than in that moment, because I'm convinced she would have contacted CPS or something and made our lives a living heck. We changed doctors immediately. What an unprofessional shat. This isn't by any chance the nurse's fault, but I had a gin apt. The nurse was the mother of a crush I had, and I just recently took his virginity. I had no idea she worked for my gin, and she had asked if I knew her son as we were the same age and went to the same school. I thought I most certainly did, a couple nights ago. I believe the proper response is biblically. Worst, being threatened with being tied down in a concrete room and injected with tranquilizer at 5 AM in a pediatric psychiatric ward after a failed suicide attempt. Also, being told I was being selfish for not wanting my verbally abusive father back in my life by my psychiatrist there. Not a doctor, but I had a nurse hit on me when I went for a checkup at 18. It was really awkward because I'm straight and my mom was there laughing at me with my little brother because my face went red and I didn't know what to do. LOL. I'd probably blush and go silent as well. I have social anxiety and it took me ages to tell a doctor. He told me to start going out more. End of discussion. Best advice ever. Nice sized uterus. During my first PAP test at 16 from a 60-year-old male doctor that was also a family friend, I nearly died. My gynecologist told me I had a nice and pretty cervix. Thanks. I remember I was in the waiting room while I was waiting for someone to look at my sprained wrist. You know how they usually have crappy public shows like Opera on? Well, there was this sports medicine guy out with me. Not sure why he was out there exactly, but he looked just how you thought, big dude, bald head act. Well, Rachel Ray was on talking about if it was a myth if women's periods actually sink. Can someone explain what she gotten into that she is testing this myth, please? But this guy looks up at the TV and says out loud, "Who the frick cares?" He then packs up his laptop and walks out. Heck, I was laughing so hard I forgot about my wrist being hurt. Okay, this wasn't to me, but one summer I was an orderly. The bad butt ex-marine anesthesiologist was getting a dude with no legs ready for surgery. He asks him, "Well, how tall did you used to be?" A registered nurse. "So, like, what is hydrogen peroxide and why do we have it at the hospital?" Yes, she was actually serious. Not me, but a former co-worker of mine told me her doctor once said during a colonoscopy, "You know, co-worker's name, redheads are my favorite." Yes, she is a redhead. Instant butt clench. No more colonoscopy. When I was about 16 I was getting a physical with my doctor and I confessed to him that I thought I was feeling depressed. He laughed at me and said I wasn't depressed. I was so shocked, because I had been seeing this guy for years and he was always nice, but that was so unprofessional and so uncalled for. I switched doctors after that. This is why I don't want to bring that up, or anxiety. My doctor, petrified that she would say that all teenagers think that they have depression and anxiety and just write it off. Have you been to the hospital for that? Said by a terrified looking nurse as I walked up to the counter of the walk-in center with a thoroughly dislocated hand. I mean, I had probably thrown her off a bit with the fact that I looked so casual about the whole thing, but it's because I was full of adrenaline and painkillers at that point. Male doctor told me that he wished he was as well hung as I was during exam. Third time a medical professional has commented on my dong size. Only time they verbally compared it to their own. Probably because the other two were female. One doctor, one assistant, and no, none of them hot enough to frick. Real life isn't a porno. I had my yearly pelvic exam while my husband was deployed. Doctor went through the normal questions so it came up I was active sin my private life, but not in the past few months. Time for the pap. They have to use a kid's small speculum. No joke, this old man doctor looks at me and said, "Your husband is a lucky man." Like WTF. To make matters worse, my mom was with me, by my head, because I was 19 and nervous, and we had a close relationship. It was so awkward and embarrassing. A roommate tried to kill himself. He survived, but was missing for 3 days, which was terrifying for his family, me and his other roommates. He had woken up in a pool of blood and driven an hour to check himself into a lockdown mental ward at a big trauma hospital in our city. When we finally got the call, we went to see him there. I went with his sister and several of our close mutual friends and roommates. After getting buzzed through onto the floor, we asked one of the staff which room he was in. The man said, "Oh, that guy. He didn't make it. Happens sometimes, you know. Sorry." Then he laughed at the sheer horror he saw on our faces and told us the room number. This was in 1999 and I am still pee at that guy. If you are new to the channel, you can subscribe. I publish new videos every day. Until then, check another video. Bye for now.